to Real People, Real Matters. This is Diana Tulchinsky with my first guest, Dr. Banerjee. Dr. Banerjee, please tell me what type of background you have in medical school.
So I'm Dr. Banerjee, physician for last 27 years. I trained in the East Coast, went to medical school in Saba University, Netherlands, Antilles, trained in University of Virginia, University of Maryland, Drexel University, so throughout East Coast. And came over, married the love of my life, who's also my business partner. And subsequently, we had kids and we settled in the North Shore, and we decided to co-found this aesthetic medicine practice. It's a truly anti-aging and regenerative medicine practice. So it's not just about a little Botox here and there. Of course, we do a lot of that, but it's about how to turn the time back and how to keep you looking your best and looking like yourself, not like someone else, in the most natural, healthy way. Bring back your youthful glow, because when you look yourself in the mirror, you feel good. And then what I see, the next step, I see people taking care of themselves. And that is our mission, to help you look great, be your best, feel your best at any age. We have patients in their teens all the way to 90s. That is the range. That's who we serve.
What is so important for teens versus like seniors for anti-aging or like pigment, like just discoloration? What is so important just to like look like in general color?
Sure. So it's all about pigment and smoothness. We are in the world of selfies, Zoom, FaceTime. We are on the social media. We are seeing ourselves and others. So if you have, as you know, you're in the media world, if you have a smooth surface, light reflects evenly and smoothly, and you look your best. So therein comes the goal of giving you even pigmentation and even smooth texture. And who doesn't want that? Whether you're a teenager or whether you are middle-aged or you are one of our senior, more mature super agers. So everybody wants that. And that's where we shine. Our lasers are the best in its class. Very safe, quick. Efficacy has been proven. The science is there. It turns the time back based on biopsies that were done in people who did lasers versus who didn't. Anti-aging genes were turned on. This is out of a study done at Stanford University years ago. It's been very well studied. Laser physics is very well developed at present. The lasers we carry go even a step further. They are appropriate for whether you have thin elderly skin or whether you have young skin or whether you are a skin of color. It's even been proven to be safe in African American skin type. And I specialized, when I did my cosmetic dermatology fellowship from American Academy of Anti-Aging and Regenerative Medicine, I specialized in skin of color. I took it upon myself as a challenge. There were about 3 of us back then, about a decade ago, when I embarked on this journey, who were interested in skin of color. So I actually had trouble finding a mentor, but I found a couple mentors in Illinois, and we took it further. And now there are more studies than you can imagine going on in mixed race and skin of color, studying laser application. So pigment is number 1, texture is number 2 that people desire. If we can help with pigment and texture, 70% of the battle is won. The other thing people come to us for is tightening of the skin, reduce the lines. Most of our North Shore patients are very comfortable with who they are. They don't want to look like someone else. They do not want to be overdone. And I respect that. I connect with that because I'm the same way. And they simply want to look youthful and aging gracefully. And that's where we help them improve their skin, turn the time back, once again, even out the pigmentation and texture. So they are shining, looking good, and it improves the skin's health through collagen stimulation, because our lasers stimulate your body's own mechanisms of healing. They activate healing. They cause controlled injury to bring about the healing factors to the surface of the skin. And in the process, you end up with the newer, more baby skin cells coming to the top. And you look more youthful, and that's healthier skin. I have to share with you, there were a couple of studies done about a decade ago that our lasers were proven to reduce risk of skin cancer. So it's not about just looking good. It's about living with healthier skin, not depending on makeup. You don't have to. You can choose to, but you don't have to depend on makeup, and reducing your skin cancer risk. Skin cancer is among the top cancers affecting people as young as 30s and 40s. It is extremely common. And our laser light therapy particularly has been proven in studies coming out of long-term dermatology practices, 10 years of data, very high quality evidence-based medicine. It shows that people who did lasers versus who didn't had more cancers. The didn't group had more cancers, all skin cancers, melanoma, basal cell cancer, as well as squamous cell cancer, versus the group that did lasers over time, not only looked younger, had a thicker layer of collagen layer in their skin biopsies, they also presented with fewer skin cancers to their dermatologist.
Why are sunspots considered like just a regular type of like, oh, I just scarred by the sun? Why are they so dangerous?
So there is UV rays. There are two types, UVA and UVB. UVA rays ages you. So you see a lot of people who have premature aging. They look older than their age. That's the action of the UVA. They didn't take care of their skin. They didn't wear sun protection, sunscreen, etc. UVB burns you. And through that process, down the road, not just with one exposure, through cumulative exposures of UVB rays, you develop skin cancer. The oxidative process happens, damage happens, and if it's not reversed and you are not protecting by using SPF, then down the road you are predisposed to skin cancer. And of course, as you know, if you're of Northern European descent, you have much greater risk of skin cancer versus people of color. However, we have to keep in mind what's happening to our environment. The ozone layer is getting depleted. UV rays are stronger than ever before. When you and I were kids, UV rays were not as strong. Now it is stronger. So I think we're going to see a change in demographics of skin cancer. One, there are more mixed race people. Two, and we don't even know our ancestry sometimes. The races have been mixed. Three, the other thing is the UV rays are so strong because of the ozone layer depletion. The risk of skin cancer is here to stay. It's not going to go away. So now more than ever before, it is important we wear sunscreen and we do preventive, proactive management of our skin with simple things like laser light therapy, also known as IPL, and the superior form of it is broadband light. Intense pulse light or broadband light can remove your sun damage going back 5 years or longer, depending on how many you do. You reminded me of something, Diana. There is also a study showing people who do laser light and other lasers, they erase years from their aging process, and they are the ones who are less likely to need plastic surgery to tighten and lift their skin.
How dangerous is like the plastic, like body morphism, like everybody's getting in some kind of plastic surgery? How dangerous is that in repetitive treatments?
So plastic surgery, first of all, lasts 5 to 10 years. This is published in the surgical literature. It is not forever. The surgery itself, in good hands, can achieve great outcomes. That is not the problem. But as we age, our risk of anesthesia goes up. Our heart and lungs don't compensate back should something happen. And there is a recovery. There is a downtime to plastic surgery. Versus you do non-surgical modalities like laser light therapy, like fractional lasers and other forms of laser. There isn't much downtime these days with the fancy lasers that are now out and available in the US market. maximum you're looking at 1 or 2 days. The post-laser protocols are highly developed. For example, we use platelet-rich plasma. We obtain it from your blood. There is no risk. We apply it after the initial cooling, after the laser is done. By the time the patient's exiting the office, the redness is already starting to come down. In the old days, they were red for 1, 2, 3 weeks. There were people taking time off to go away for 2 to 4 weeks to recover from laser. Our world has changed. The laser world, with the newer state-of-the-art lasers that we offer, for example, Halo Hybrid fractional laser, fantastic results, very safe, and very quick recovery. We need 24 hours. 24 hours, why? Because the skin is very sensitive. You're allowed to put on mineral makeup. It has been studied to be safe, safely used post-laser, but nobody wants to put anything on. We've been doing this for a decade. Nobody wants to because the skin is sensitive. They don't want to touch. So I tell them, allow 24 hours before you'd be willing to put things on your skin, and then you can go about your business. And many of our patients actually go right back to work. They turn the Zoom function off, those who work from home, for example. They pick up their kids, they run grocery. They just won't show up at a gala or a major meeting with a red face. So downtime is really not a big challenge these days. We have many things. We have growth factors, we have exosomes, platelet-rich plasma. We can adjust the setting, we can increase cooling. There are many tricks under our hat that we can do to help with the downtime. Most of our women are working women, and even the busy moms who are stay-at-home mom, they're very busy these days. Nobody wants downtime. So the consumer demand forced us to evolve our post-care protocol. And I'm proud to say we have achieved it. All we need is 24 hours.
Oh, great. And do you help men and women with hair restoration, like alopecia?
Absolutely. That's another whole big growing field. Hair loss, especially since COVID hit. COVID has caused hair loss. Some people don't realize that. And then hormonal changes. Our middle-aged women like myself, we are going through hormonal changes and hair is thinning out. We are experiencing more hair loss than we ever did in the decades past. So hair loss is a huge problem, because what good is a pretty face if it's not framed beautifully with a nice hairstyle and nice quality hair? Hair is very important. So we do help people, especially in the early stages of hair loss. The therapies we do with platelet-rich plasma, exosome, and other medications, it's very effective. What happens later down the road in the process of hair loss, you start losing follicles. When you start losing follicles, we cannot do much. Then at that point, you have matured to the stage of needing hair transplant. So thick hair follicles, the high quality ones, will be transplanted to the areas where you have lost follicle. When patients come to us with complete baldness and loss of follicle, we cannot help them. All we can do is get their scalp in a better, healthy condition and stimulate the environment with PRP, send them for hair transplantation, and when they come back, stimulate again to preserve what has been transplanted onto them. But up until that point, when they are losing hair, thinning hair, etc., we can definitely help improve and preserve the existing hair follicles. There are several ways to do that. And it is not painful, and there is no downtime for that.
And do you do anything for body sculpting, like that? Say,
Yes.
Like
Absolutely.
a person's like pregnant or like postpartum or anything like that.
It's funny you asked. I recently was reading a study. Americans are spending more time than ever before on going to the gym and taking care of themselves. Obesity is almost an endemic.
Very prevalent, yeah.
3/4 of our population, especially after COVID, are overweight. At least half of our population is obese. So it is very important, and we are aware. Americans are aware, and they are going to the gym, working out. So going back a couple decades, only option was liposuction and weight loss. So there are two types of fat. One is organ fat, that's deep inside, and other fat is subcutaneous fat, that is right under the skin. So for the organ fat, people have to live a healthy lifestyle. have to follow a healthy diet and work out. It's 90% diet and 10% working out. Now, let's talk about the subcutaneous fat, the under the skin fat, the bulge that doesn't go away despite you working out. That's where we play a role. I'm not a surgeon, so I specialize in everything non-invasive. So we have non-invasive ways of sculpting the body, melting the excessive fat that wouldn't go away, that stubborn pocket, in those people who are already working out. And we use Warm Sculpt. Warm Sculpt is kind of a cousin sister of Cool Sculpt. Cool Sculpt is better known because it's been around longer. Cool Sculpt had a few issues. They were the first ones in the market. They weren't getting smooth edges. It was operator dependent. So Warm Sculpt came about a decade ago. It's FDA approved. All our devices we use are completely FDA approved and made in the USA. That's who we favor, because then there's accountability and we have direct relationship with the industry partner. If something goes wrong, they will fix it. So that is what we bring to the consumer, versus if you're not using FDA approved machines, then there's no accountability there. So we use FDA approved SculptSure, also known as Warm Sculpt. It melts the fat to death. It is a specific laser wavelength that was discovered by laser physicists that is only attracted to fat cells. So it'll penetrate. We put on the adapters. Let's say I want to melt this fat. We put on the adapters. It goes through the skin without harming the skin, because it is not attracted to the skin, to our advantage. It goes straight to the fat and causes an inflammatory reaction. Over the next several weeks, the inflammatory reaction bursts open and kills the fat cells. And then your lymphatics, your liver, your kidney, your gut, all the elimination organs take over and clear off the dead cells.
Interesting. And when did you start Halo Medicine?
We started 10 years ago. It's actually our 10th-year anniversary. We started in Northfield, just a mile away from where we are, and we recently moved to our Glenview location. We have a secondary, smaller location in Wilmette also, where we provide laser services, but our main parent location is in Glenview.
And how do you like the Glenview area compared to
It is
Northfield?
fantastic.
Yes.
Our patients love it. We love it. We realized a lot of our people were from Glenview anyway, so they're very happy that we are even closer to them, and the location is very convenient. People come to shop at Trader Joe's or Heinen's or in downtown Glenview, and they stop by. They're enjoying it and we're liking it. We're very happy, and the Glenview community is great. They've been very supportive, starting from the chamber to local shop owners and of course the public in general. They're very friendly, very good population. We are happy to be of service to them.
And why is holistic medicine so popular compared to like old years ago, like 20 years ago, like, like just get the drugs and then just go away from the doctor's office?
Yes, so I think the public has woken up. There's a consumer demand. Consumers are demanding that we get to the root cause. So functional medicine approach, holistic medicine approach is becoming more important than ever before. I believed in it a long time ago. When I finished my training over 20 years ago, I realized that just writing a prescription was not good enough. There was a study I read, it said over 60% are not even filling the prescriptions that we write. So that made me question, are we really effective? So there's something more that the consumers are looking for. And here we are 20 years down the road. Now more than ever before, people want us to go to the root cause. So how we apply holistic approach to our anti-aging practices. I do a lot of the consultations and our personnel is also trained. We go to the root cause. We first educate them what they need, what they're dealing with. And we go to the root cause. Why is there premature aging? Is there smoking? Is there genetics? Is there something in their environment? Is there something in their food? For example, our mom patients bring their teenager kids. They have acne. I don't just treat the acne on the surface. I go examine their lifestyle. Are they eliminating? Are they constipated? Because if the gut is not eliminating, the skin has to work harder, and that's where acne and rosacea flourish. because the skin is on overdrive trying to eliminate, because your other eliminating organs are not doing well. Your liver is not doing well, your kidney is not doing well, or your gut isn't doing well. In the teenagers, they're often eating a lot of processed food, and they need to be educated about that.
Is it safe for cardiovascular patients and oncology patients to go through like any procedure? Do you do nutritional counseling with them and, lifestyles?
Right. We do more of a lifestyle medicine approach, not just limited to nutrition. And certain things are safe. For example, in pregnancy, there are certain pills that are safe. Majority are not. We will wait for them because nobody studies pregnant population. Likewise, in oncology, we actually specialize in oncology patient skin care because chemotherapy skin after chemotherapy is very different. It's broken down and they need regeneration. So there are things, there's a skincare line and there's laser light therapy that will actually help them. But we often have to wait for their course of treatment to be over, but we can support them in gentle ways. The other population was, I think you said elderly and cardiac patients. Cardiac patients, laser light therapy is safe. However, deep laser may not be safe depending on what they have. If they have pacemaker, etc., I have the ability to monitor their vitals continuously during procedure. But we will assess. There are non-invasive, less invasive modalities available also. There are surface treatments like microdermabrasion facials, hydrofacials, diamond glow combined with peel. Those are gentler and that can also revive their skin. They don't always need a deep laser. But once they are stable, we communicate with their physicians, then we can do other things like laser light therapy.
And what are there ways to refreshing the skin and grow collagen?
Sure. So besides laser that we already mentioned, we have collagen stimulating fillers like Sculptra, Radius fillers, and then we have instantly filling hyaluronic acid fillers. Hyaluronic acid actually exists in our layers of our skin, but over time we break down, but we don't make enough. So hyaluronic acid fillers are instant way of refreshing and boosting the skin's hydration. And most popular ones are Juvederm, Restylane, things like that. So we have both kinds of fillers, and certain kind of fillers will go into your lip, whereas other fillers will go into your cheek, temples, neck, and other parts. We also do fillers for hand rejuvenation. Those are instant and very gratifying ways to make you look good fast, almost instantly. But I'll tell you, our most popular treatment is Botox. That's what people walk in for. And then they realize they have so many other options which last longer than Botox. Botox is basically a purified protein derivative. It's not the actual bacterial product where it was originally discovered from the Clostridium species. It's a purified protein derivative made in the lab. It relaxes the muscle layer that exists underneath the skin. So when the muscle relaxes, the skin stretches, so your lines go away, basically. However, Botox lasts an average of 3 months, and it needs continued maintenance treatment.
What about like small areas for injections? Like, do you have like mainstream Botox for the whole face, and then like smaller injections for smaller areas?
I see. Okay, so we call it microbotox, microtox. Microtox. Yes, for smaller lines where you cannot take a whole lot of muscle relaxers, we will do that. But most common areas for Botox are forehead, crow's feet line, lower face, tightening these nephrotides line, we call it. We can also do necklace lines in the neck and the strong platysmal bands some people have. It can go many places. There are some medical applications of Botox also. For example, for headache, we do headache Botox, lower back pain, Botox. For hyperhidrosis, some people have excessive sweating where they cannot mingle freely in a social setting. We help treat the excessive sweatiness also with Botox.
Thank you. Thank you, Dr. Banerjee, for this informative conversation.
Thank you. It was my pleasure to be here, and we are very grateful to be in the Glenview community. And I thank the community, Glenview and surrounding, for supporting 10 years of Halo Medicine.
Thank you for watching Real People Where Matters. This is Diana Tulchinsky with Dr. Banerjee of Halo Medicine.